Well, what to tell about me? I'm German. I was born in West Germany. I studied dentistry in West Germany. Then I went to the army, and then actually I left Germany. I was around 27, 28 when I left. I worked then many years in Switzerland as a dentist and implantologist. And well, due to circumstances in the family, I started to travel more, started teaching the technology which I had invented. And this is the technology of the strategic implant. So that's in short about me. My main job is, I would say, teaching. Of course, I'm also working on patients a lot, so I treat a lot of patients and put many hundred implants every month. But the teaching, also the writing of articles and of textbooks, is I consider my main work. Approximately 15 years ago, I came into contact with the field of traumatology and orthopedic surgery. I was doing implants before already. I also worked in immediate loading protocols before already. I do this already more than 20 years. But I never understood the principles, how this works. Because in our profession, the doctors and the students are taught by university and implant manufacturers that the surface of the implant, of this dental implant, is very important, and if somebody invests in the surface, so buys an expensive implant, for example, then this surface will lead to good osseointegration. They call this osseointegration, so this is the technique or the method of osseointegration, and after osseointegration the implant is then stable. Now, I'm not saying that this doesn't work, but I'm saying this method of osseointegration has a lot of disadvantages. First of all, these implants are quite big, I mean, from the diameter and from the length. And the idea behind this osseointegration is that the implantologist has to use big implants, I mean, big diameter implant, and that especially the surface of the implant is big. It's even made bigger by sandblasting and etching and to create this micro roughness. And so the idea is that implants have to be big in order to be able to transmit the forces. This is a mistake. I mean, the whole thinking behind this concept of osseointegration works, but it's based on wrong thinking. It's simply, these people don't understand what the bone wants to survive, to feel well, and in traumatology, in orthopedic surgery, beginning approximately in the 1975, in the 1975, a completely different technology was developed. This was the cortical fixation, the osseo-fixation of the implants. So these implants in traumatology, for example, they are mainly used in an immediate loading protocol. Means, for example, you break your leg in the skiing, then you undergo the surgery, they put the screws, the plates and so on, and of course you cannot play football next week, but you can walk carefully, maybe you have some crunches to support it, to keep the forces low, but you are walking, you are not in the bed, you know? And this technology of the osseointegration, this conventional old treatment technology, is like keeping people in bed. So they have an unloaded healing time, they cannot wear dentures for weeks or months, so that this implant is not disturbed when it heals in. So this is a very inhumane, very also expensive, and doubtful treatment. So I don't work with this process of osseointegration all my life. I never believed in it, and I cannot understand how somebody today is still doing this. The right way to put implants in connection with the bone, this is how the traumatologists and the orthopedic surgeons are doing. So they're putting whatever they put, plates, any devices which they have to connect to the bone, they're always connected to the corticals, to the hard bone. And if you ask the traumatologist, are your implants also integrating? They will only look at you like they don't even understand the question, because this technology of osseointegration is not used all around the world in traumatology, and of course also not used in orthopedic surgery. And I mean, just to mention this here, also bone augmentation are not done in this field. No, everybody works only with a natural bone, and this is how it should be done. I mean, every person also in the oral field has enough bone. Nobody needs bone augmentation if only the proper implants and the proper technology is used. And this is exactly what we are doing in the Sімпладент clinics. We are using a technology which avoids bone augmentation, which works with a native bone, and which works immediately in protocol. So this is of course what the patient wants. So to conclude this, what I did in the last 15 years is to transfer the rules of traumatology and orthopedic surgery into the field of oral pathology. And this was a successful process. I mean, it works today very well. We have treated tens of thousands of patients, millions of these implants have been placed. So we are pretty sure it works, and we see the advantages, we see the progress. More and more doctors are learning this, and more doctors are running away from this osseointegration, from this the bone has to grow to the implant theory. If we work with the process of ossifixation, then I, as a surgeon, I'm screwing the implant in, I'm bringing the thread into contact with the cortical. I can feel with my fingers and my hand how strong is the contact. I feel the torque. And if the torque is good, then I can just relax. It's done. Nothing will ever move this implant. This is how we work, and it's so beautiful. We don't have to hope and pray that osseointegration helps. We ossifixate the implant and it's done. It's really done. And I think all dentists should see this and should start to understand this, and then they will very quickly forget about this osseointegration and all these stupid two-stage implants, multi-piece implants, and so on. Of course, these implants are also crazy expensive, so it's not necessary to have all these complicated things. The simple things that work, and this is the technology of the strategic implant that really works. Well, Sімпладент in Ukraine was actually formed in 2014. Actually, in the middle of the Maidan, I was here in Kiev, and we were forming the company. We were planning this. We set up the company, and then this was all developing. Then later we found the premises. We built up the clinic, and since then we work here. It's already seven years from now. In the meantime, we have good staff. A lot of doctors work for us. Good doctors who have learned the technology of the strategic implant, and we can treat a lot of patients. Actually, it's many patients. It's sometimes I think it's like an assembly line, but in the end the patient wants the teeth and they get it, and they better don't think about those 3 days. How often they have to come, and I mean it's really a big movement here in Щасливе, in the village. The question, how long does it take to learn, this is not so easy to answer. It's not for everybody the same. First of all, I would say for two-stage implantologists, those implantologists who work with this process of osseointegration and who have learned all this, they have a lot of difficulties learning this because they have to unlearn first. So unlearning is a very difficult process, and the old ideas they are always coming up, and the doctors are mixing up these old ideas of this osseointegration implantology, and then I see that not rarely they take wrong treatment decisions, although they work with ossifixated implants. So this is a group of doctors who must be especially careful to always understand what we are doing, and what they are doing. If somebody comes new from the university, or maybe with a little bit of experience in surgery, especially extracting and stop bleedings and handling infections, this is all important to know how to do it. And if this little bit experience is there, let's say 2-3 years of work in some surgical department or in a clinic where surgery is done, then it's of course ideal situation to become surgical implantologist, so to put the implants. And I would say if they concentrate a little bit and they come to courses and they have a lot of supervisions and look at other doctors operating, I would say in half a year they can start working safely on patients. They will be here and there some problems, some mistakes can be fixed. And this is actually my job here in this clinic to help fixing things and to reassure the young doctors that they do the proper thing. Also to reteach them is very important. So I would say in half a year I can make a strategic implantologist out of a doctor. The next thing is prosthetics. I think it takes the same time, half a year, to work under supervision, to see these prosthetic procedures, to learn how to cement and so on. This is a little bit different. All the prosthetics is different, also from the concept of mastication, occlusion, and so on. But this can be learned, and I wrote enough textbooks. It's all written down, so somebody can also read it. I'd say half a year is right. I see on the other hand doctors who already come 2 years to the courses and they still don't work successfully. Maybe they don't dare, and maybe if you learn something over 2 years, you forget too much from what you learned in the beginning. So if we do this all in 7-day courses, so the doctors comes around 10 hours per day and 7 days in a row, and a lot of teachers are going to jump on the participants. But in these 7 days, and they're not allowed to bring the mobile phone. Simply, this all has to stay at home. We will jump on them and really in 1 week make an implantologist out of them. And of course, in this 1 week, they don't forget anything. So what we teach them on day 1, we will repeat it on day 2. They give them more knowledge, new knowledge, repeat, and so on. And after 1 week, the brainwash is complete and everything should be in. So I suggest that doctors rather look for fast courses, fast-track courses, so that they don't forget. Now, the forgetting is the big problem. I mean, they forget things they should remember. Oh, this is one problem that our brain has, and on the other hand, thinking about your lost boyfriend, there you can't forget. This is the paradox situation of our brain. Some things you cannot forget, and other things you forget from one day to another, and you should remember them. So teaching is always connected to repeating things and to learn a lot of stuff in a short time. To learn the whole thing, to get the whole picture. That's why I suggest to learn fast. Okay, why is it so fast? And the second question, if I understand correctly, if it's so fast, can it be quality? Okay, let's come to the first question. Why is it so fast? We are using the cortical bone, this hard outer part of the bone for fixating the implant, and there is no healing time necessary. So if the implant is fixated properly in this hard bone, we will have no problem with the immediate loading protocol. On the other hand, we also put more implants compared to this 2-stage or to this old implantology. So we distribute the loads to more implants and to a lot of surface inside the cortical bone. So that's why it is so fast. Means we don't have to wait for the bone's healing. Since the implants are also made from titanium, actually titanium alloy, they also osseointegrate over time. So after this ossifixation, we load it, we put the bridges, patient starts to eat, patient starts to forget about the implant, but the bone is then in contact with the implant body, with the surface of the implant, and because it is titanium, osseointegration is going to happen. So osseointegration has nothing to do with the surface of the implant. Osseointegration is only connected to the titanium as a material. So basically every piece of titanium is an implant. So I mean, all this idea that the surfaces are so important and that you have to pay a lot of money for the surface, so that one implant is 350 euros because of beautiful surface, this is of course rubbish. It's only the titanium that makes the bone integrate the implant. So our implants are fixated in the cortical, and later on in all the rest of the length of the implant, which is inside the bone, by chance, it will also integrate. Now, if it's so fast, can it be quality? Well, as I explained, quality is the question of the surgical quality. Are all the implants placed in the cortical? It's a question of the prosthetic quality of work. Now, is it like beautiful? Are the teeth in the right position? Does the mastication work? Can the patient eat on both sides equally, and so on? So there, I would say there's no difference regarding the quality of this old conventional implantology and the new conventional implantology. It's not that this is high class or we are high class. I mean, it's all the same. We make people eat. That's our job, you know.